Good evening. For the first time in months, the Milwaukee Health Department says that the city is back in the high COVID transmission category due to COVID cases climbing over the past week.
Meanwhile, the CDC still considers Milwaukee County to have a low level of community spread. Ben Jordan goes in depth to explain the different criteria being used that's resulting in conflicting messages.
The city of Milwaukee is back in the red when it comes to COVID transmission, meaning cases are climbing by the day with this new Omicron subvariant. Pharmacist Dr. Demi Sokol says Hyatt's Southside Pharmacy is seeing the trend in real time.
The month of February and March were very, kind of calm. Not a lot of people were testing. The positive cases had gone down too. So if, like, for example, we were testing 50 to 60 people, it was like 1 or 2 cases that were coming back positive for the PCR test through the state program. But now for every 60 to 70 people we're testing, it's around 10 to 15 people who are coming back positive, which is from 15 to 20% positive rate.
Milwaukee's health department data shows the city has surpassed its threshold of 100 or more cases per 100,000 residents, putting Milwaukee at a high rate of COVID transmission. But the CDC still shows Milwaukee County to be at a low level of transmission. UW Health Infection Prevention Director Dr. Dan Shirley says the 2 sets of guidance can be puzzling.
It's confusing. We've had multiple meetings, even in our hospital, with people that have been following this all along. And these levels and this risk is confusing.
The CDC switched its community spread level guidance a couple months ago, increasing the threshold for high transmission to 200 cases per 100,000 residents in each county, while also factoring in COVID hospitalizations and bed vacancies.
That has more to do with, should we have mask mandates for indoors across the board?
The Wisconsin Hospital Association shows about 200 people are hospitalized with COVID statewide, which is way down from January when there were more than 2,200 COVID patients. Dr. Shirley says that's likely because this subvariant is typically less severe and a large portion of the population has either already been infected, vaccinated, or both.
We're, of course, watching for hospitalizations to see if they trend up, but now it's been several weeks of rising cases in the community. And if anything, it's ticked up just a little bit, but nothing like it was, during the big Omicron surge.
Back at Hyatt, Dr. Sokol says Milwaukee area residents are better off basing their masking and large gathering decisions on the Milwaukee Health Department's current transmission rate.
I would definitely say, looking at the local numbers makes far more sense because we're a densely populated city.
Milwaukee's health commissioner told city leaders here today that she expects the city to climb above 200 cases per 100,000 residents by sometime next week. Once again, that is one of the main criteria for the CDC to consider an area to have a high level of community spread. Reporting in downtown Milwaukee, Ben Jordan, TMJ4 News.
All right, Ben, thanks. Let's look at the COVID numbers across the state, and they are trending up. Look at that number right there. More than 1,600 cases reported today. Keep in mind, that's just a one-day number, and that's not a number we have seen in the last 2.5 months. Let's look at the 7-day average, because it's always better to take a look at over a 7-day period. We're now seeing 1,200 a day. That is the average, and you can see that is up from the 14-day average. So not only is this happening across the state, but in Milwaukee County as well. When we click on Milwaukee County, they've had 175 cases over 14 days, but on the 7-day average, it's up to 222. Again, overall numbers are still very low. Shannon?